Hello, and welcome to Inside Cancer Careers, a podcast from the National Cancer Institute. I'm your host, Oliver Bogler. I work at the NCI in the Center for Cancer Training. On Inside Cancer Careers, we explore all the different ways that people join the fight against disease and hear their stories. Today, we're talking to Dr. Nathan Vanderford from the University of Kentucky, who runs a program for high school and undergraduate students that are tackling the cancer crisis in Appalachia. And we'll also have two of the alums from that program on the show. It's a pleasure to welcome Dr. Nathan Vanderford to the show. He's an associate professor in the Department of Toxicology and Cancer Biology at the University of Kentucky College of Medicine and the director of the Appalachian Career Training in Oncology, or ACTION program. Welcome, Dr. Vanderford.
Thank you very much. It's great to be here.
Before we jump in to learn more about the ACTION program, I wanted to ask you about your own journey to the position that you hold today. What was it that got you interested in science and cancer?
Yeah, from a very early age, from 5 years old or maybe a little younger, I had aspirations of being a medical doctor. Didn't quite make it there, but, in science nonetheless. But I think I was inspired by, being sick as a kid. It turns out, long story short, grew up in a house where we burned wood to heat our house, and I was allergic to the wood smoke, and it would make me very sick as a kid in the wintertime. And so I was inspired. I wanted to, help others that were sick like me. And then, over time, I just got even more interested in science, basic biology. I wanted to really understand how we worked, like, biomedicine, biomedical research really interested me. And so when I went to college, all I wanted to do was just take biology and chemistry classes and learn as much as I could about how we as humans function.
Fascinating. You have an MBA, a Master's in Business Administration. That's not a common qualification among scientists. Can you tell us what prompted you to get an MBA?
Yeah, so when I finished training, so I did a postdoc at Vanderbilt, and then I came back to the University of Kentucky and started a quote, real world job. And, some of the things that I was doing, I could see where even though I just said I loved being an undergraduate and grad student and learning everything I could about science, but I missed out on opportunities to learn other things and, business administration concepts. I think many of us use in a variety of different job settings. As scientists, if you run your own research program, you have grant funding, whatever the case might be, having some business acumen, some business understanding of business principles, even working in an organization and trying to understand how the organization functions and how budgets work and all that kind of thing, I think is really useful. And so I was kind of inspired by that and the lack of knowledge in these areas and, just being sort of a sucker for wanting to learn more and, loving education. I thought I'd go back and get an MBA, and it's been really useful. I think, I learned a ton of things that I wouldn't have otherwise known. Met a lot of great people that some of which I'm still connected with through that program. So it was a great opportunity for me.
You focused on mentoring and teaching, as you just mentioned, and giving career guidance to the people you are mentoring. You've even co-authored a book, Research, a career guide for scientists, and you've written about graduate education. So where are we, in your opinion, in 2023 regarding the biomedical scientist training path?
Yeah, that's a great question. And I think, it's a question that is being asked out there a lot, in the media. What I tell people is getting a graduate degree or a professional degree is a phenomenal opportunity. I think, we are blessed to have these opportunities to get, a high level of education. If we talk specifically about, PhD level education, we're getting paid to get educated and to learn and to, do science, discover things that nobody else has discovered before. So it's a fantastic opportunity. That said, though, as many of us know, there's issues in the PhD training world. And I think, while it's a phenomenal opportunity, I think we have a lot to do in terms of making the training experiences better, more positive for trainees. And I think that we have some opportunities to improve how we train trainees and to better align that training with the jobs that our trainees are actually getting today, rather than focusing specifically on preparing the next generation of faculty members when, as many of us know, a small sliver percentage of our PhD trainees are actually going to pursue and obtain that kind of career path. So there's a lot of other training that we need to be providing our graduates.
I'd like to pivot to talk a little bit about the Action program now. Can you tell us what it is and how the idea came about?
Yes, so Action, the Appalachian Career Training and Oncology Program, it's an experiential cancer education training program. It's funded by the National Cancer Institute, which I'm very, very, very appreciative of. I think we'll get into this more in a little bit, but it's a youth science R25 program. We're very fortunate to be funded through that mechanism. It's a fantastic mechanism. It's through this R25 mechanism. There are three components of the training. There's research, education, and outreach aspects of the program. And so we recruit students and prepare and motivate them for cancer biomedical careers. And I think we're going to get more into the specifics of who we're reaching and what our specific goals are. And, we're very excited about those goals because our program is really situated in an area that has great need for this kind of work.
Yeah, you mentioned the R25. That's a program through the Center to Reduce Cancer Health Disparities at NCI. And it is a program designed to help people to experience science and think about careers in science. So I think your program is definitely an excellent component of that bigger program. So you mentioned just briefly, you alluded to the cancer situation in Kentucky and the books that you've published with your participants we'll get to in a moment, but they talk about a cancer crisis in Kentucky. Can you tell us a little bit about that?
That's right. And I think I forgot to answer part of your other question. So I'll circle back to.
Sure.
So sort of how it came about. So, it came about because of this cancer crisis in part. So for those who don't know, Kentucky has a massive cancer problem. We rank first in the nation in overall cancer incidence and mortality levels. So no other state in the U.S. has a worse cancer problem than does Kentucky. And that's bad. I mean, we're talking, over 30,000 new cases each year, over 10,000 deaths in the state. So significant cancer problem. That's bad, but what's worse is that the cancer problem is significantly worse in the eastern part of the state, the part that's in the Appalachian region. There's 54 counties out of the 120 counties in Kentucky. These 54 counties have really significantly higher cancer rates than does the rest of Kentucky, which again is number one in the country. So that was part of the motivation for this program. I mean, I think that describes the cancer crisis, and it's not to be sensational in saying that. I think, in my opinion, we really do have a crisis. I mean, in terms of the high rates of the disease. The other inspiration for the program was, and this is some of the reason why the cancer rates are so bad in Kentucky. There's also, again, Kentucky doesn't rank so well in education levels across the state. But again, that's worse in East Kentucky. So education attainment levels are low. So you sort of marry the cancer crisis with the education crisis. And so coming up with the Action program sort of, was a no-brainer in terms of trying to think of a long-term strategy to help solve the cancer problem while also addressing the education attainment, really focusing on, providing opportunities, resources for students to help them prepare academically and succeed academically, while also providing this cancer training was, I thought, a phenomenal opportunity.
So you draw your participants in the program from those 54 counties on the east side of the state, the Appalachian region. Is that correct?
Absolutely. Yes. So in our program, we engage high school and undergraduate students as participants. Through our outreach, we reach elementary through, community members of all ages. But participants specifically in the program are high school students and undergraduates, and specifically from those 54 counties in eastern Kentucky.
Yeah, and we're going to get to talk to two of your alums in this next segment, but I read the books that you publish with your participants. These are personal essays written by the high school students and undergraduate students. I have to tell you, very impressive, very moving, very thoughtful essays. How did you come up with the idea of actually bringing out these books?
Yeah, that's a great question. These essays are, I'm biased, and you said it too, but they're phenomenal. Originally I wanted a way that we could sort of innovatively, uniquely engage the students in a learning exercise, have them explore their personal connections with cancer and get them to think about cancer in their families and their communities. And so that sort of was the inspiration of this idea to have them write essays. You know, originally it wasn't a project where I thought we would publish these essays. It was just, really an activity to get the students to think and, start talking with their families and learn about cancer in their communities. But they were just so phenomenal. I thought, man, other people need to read this. And so that's when, I started talking. We have a university press, our university. The first book was published by our university press. And they also thought it was something that needed to get out there in the community. So, the students learned a lot about cancer. I think many of them, particularly the high school students, it was a great exercise in writing and being critiqued and learning how to be, go through edits. As a high school student, when I was a high school student, I would write something, turn it in. I might get a C on the paper, but I didn't have an opportunity to revise it. And in the scientific world, it's all about writing and rewriting and editing and revisions. So I think that was a big learning step too for the students. So we went through all that process, and then getting it out there has been a great opportunity to engage the community here in Kentucky, but even more broadly. You said you've read the books, and so they've been distributed beyond the borders of Kentucky, which I think is phenomenal.
Yeah, absolutely. I recommend them. On your website, the program website at the University of Kentucky, you have information about all the different folks. Can you give us just a feel for the numbers? How many participants have you had over the years?
Yes. So alumni and current students, we're at 116 now. And that breaks down to about there's 60 high school students, 56 undergraduates. And for those who aren't maybe as familiar with the YES program as others, it's a 2-year program. So students are in the program 2 years, and we engage our students continuously across those 2 years, not just in the summer. So, 116 may not sound as high as what some other programs are able to accumulate over the years, but I think this long-term engagement, is significant. It has a significant impact on our students.
And one of the goals, I guess, is to interest students in a career in biomedicine, perhaps even in cancer research. Have you got some outcomes information? Has that happened?
Yeah, I think, the students are who make the magic happen. They're the phenomenal ones of this whole thing. And we've been very fortunate. So our undergraduates, we have 40 alum who, have finished the program. Out of those 40, so the undergraduates, we have 33 that have gone on to either professional or graduate programs. And out of those 33, we have 25 that have gone to medical school. And you're going to hear from one that's in medical school now in just a little bit, and another that's going in the fall. And that's phenomenal, I think. And what's really exciting is that these students are continuing to also be interested in research, not only medicine, but they're continuing with research too, which I think that, I hope, and we'll see what the students say, but I think that we help spark that interest, where maybe they might have done some research without this program, but I think that they might not have done it as deeply or in such a sustained way without it. Our high school students are also being, very successful. Out of 20 that have graduated high school now, 18 of those have gone on to college, which is way above what's expected in Appalachian, Kentucky. We've already talked about the education attainment issues. It far exceeds the percentage of those that go to college. And I mean, I think all of them, the last time I checked, are in a science related field and are continuing the steps to pursue the next thing of graduate school or, professional school, focusing on research or medicine.
Anything else, Dr. Vanderford, that you'd like to share about the ACTION program?
Oh, I'm just so grateful for the opportunity. We have a renewal grant in review right now. It's going to be actually reviewed later this month. So we'll see what happens in review, but I really look forward to either now or in the near future, getting this program refunded and continuing. The other exciting thing that has just very recently happened, I think that adds another layer of impact, is that I've worked with our philanthropy groups here on campus in a variety of different ways, but we just had some donations to start a scholarship program for our students and current students and alumni, which is huge because, many students from this area need significant financial support to be able to attend college. And so I think this is going to be a great opportunity to continue supporting our students beyond being in this program and helping them, be successful doing whatever it is they want to do.
Well, thank you very much, Dr. Vanderford. We're going to take a quick break, and when we come back, we'll talk to two of the alums of the Action Program. PubMed lists over 270,000 cancer papers published in 2022. That's a staggering 750 papers every day. It's great that cancer research is such an active field, but it makes finding the pubs that are critical to your work a challenge. What if you had an AI that paid attention to the papers you read and suggested others as they appear in PubMed? That is exactly what the NCI is building with an app called Nancy. With me to discuss Nancy are two members of the team that are creating Nancy: Chris Perrine of Blue Pain Studios and Duncan Anderson of Humanize AI. Chris, you've been building apps for NCI for over a decade. What is new about Nancy?
Oh, thank you. Fundamentally, Nancy represents a shift in the scientist's user experience. In prior generation of apps, people had to know where to look to find things. Now they can find information using AI agents. I think of Nancy as a friendly research assistant who makes suggestions and answers questions. Of course, it is the early days, and Nancy is still learning from their users, but they will get better and better over time.
Duncan, you bring AI expertise to the project. Can you tell us what capabilities that brings to Nancy?
Yes, Nancy is all about connecting scientists. Right now, the focus is on connecting them to papers relevant to their interests, which Nancy does by matching vector representations of abstracts and looking at co-citations. If you tell Nancy that you find a group of papers interesting by bookmarking them, the app will keep an eye on PubMed for you and suggest related publications. You can also share these folders with colleagues and export them to your reference manager. You can read the papers right there in Nancy and follow any author to see when they publish preprints. Down the road, we intend to help people network based on shared scientific and career interests, and much more. These are just some of the features coming to the app.
Thanks, Chris and Duncan. Right now, Nancy is available in the Apple App Store, and it will be coming to Android later this year. Download it and give it a try. Your feedback on Nancy is very welcome. You can send it to us here at ncicc@nih.gov. Welcome back. I'd like to welcome Susanna Goggins, who is a second-year medical student at the University of Kentucky. Susanna participated in the Action Program from 2018 to 2020 and is from Johnson County, Kentucky. Welcome, Susanna.
Hello, thank you for having me.
Also with us is Michael Buoncristiani, a senior at the University of Kentucky, majoring in biology, neuroscience, and agriculture and medical biotechnology. He's starting med school there in the fall of 2023. Michael was a participant in the Action Program from 2019 to 2021, and he's from Wayne County, Kentucky. Welcome, Michael.
Hello, thanks for having me.
I'd like to start with you, Susanna. In your essay, Malignancy in the Mountains, which is in the first book, you described the events of the summer of your freshman year. What happened?
So the summer of my freshman year, well, first of all, in April, my mom called me and she said, I went to go get my yearly free scan from UK. She had been going once a year through UK's ovarian cancer prevention program and getting a transvaginal ultrasound, which was part of a study that they were doing. So her and my grandma would go once a year and get this ultrasound done, and it was to detect any signs of ovarian cancer. And she told me, she said, they saw something a little suspicious. They're not too worried. I'm going to the doctor. And then I was like, oh, okay, well, you say not to be worried. And so then in that May, I took my first finals of my freshman year at UK. I came home. My mom went to the doctor. She said, well, they said I need a hysterectomy, but still nothing to be worried about. And I said, okay, still hysterectomy, that, okay. And so then the hysterectomy came around. And I was interested in medicine. So I had already watched the YouTube videos on like how, what hysterectomy is. I knew how long it was supposed to take, and it was supposed to take around 2-ish hours. And I was at home. My dad was in Lexington where she got the surgery with my mom. And then I was at home because I was in charge of watching my little sister who has cerebral palsy. So she needs 24-hour care. So I was in charge of babysitting her for like these couple of days that my mom was going to be in Lexington. And I was like, kept on waiting, and I noticed that she wasn't coming out of surgery. And I kept on texting my dad. I was like, "Did you forget to text me? Is she out?" And he was like, "No, no." And then eventually I got the phone call that they found cancer, that the cyst in her ovary was ovarian cancer. And I guess I should have been a little bit more expected because I knew there was a little bit less surprise because I knew there was a chance. But it really took me aback, or it took me back by surprise for some reason. And yeah, the good news is because she was part of this screening program, they found it extremely early. Ovarian cancer is notorious. If you Google just ovarian cancer, you'll see that the mortality rate is like 50%. It's really high. But usually they don't find it until around stage 3. They found hers in stage 1 at the very, very, very beginning. So we were very, very lucky for that. And then she went through her 6 rounds of chemo, and ever since then she's been good. So it was an interesting summer. It was kind of a rough summer and fall, but we were all so thankful for that program that found her cancer so early that she just needed the chemo, and now it's been over 5 years and she's still good.
Yeah, you described the wait during the surgery when you don't get the text and you don't get the text. It's definitely, I wonder what was going through your mind at the time.
A lot of thoughts. I was having a busy day anyways because I was taking care of my sister, and I wasn't like too used to taking care of her without my mom because my mom is a stay-at-home mom, so she's generally home. Like I help her with her a lot. And so I was already a little bit overwhelmed with that. And I was also trying to get like the shadowing program set up at home so I could be shadowing in the local hospital that summer. It was the very beginning of my summer break. And so I just kept on wondering. I don't even think cancer really crossed my mind, but maybe that's what happened. I just kept on thinking that she had just gotten out, and my dad was just so over, like someone gets out of surgery, he was just busy and had forgotten to text me. So that's really all that was going through my mind. And eventually, when it hit around hour 3 or 4, I was thinking, well, maybe something's wrong, maybe, but it really didn't cross my mind that much until he called me.
Yeah.
Once he called me, I kind of knew since I saw it was a phone call, but
yeah, came out of the blue like a shock. Yeah.
Yeah.
So, Michael, in your essay, A Continuous War, Cancer in Kentucky, it's in the second book, you describe that your first contact with cancer came through your grandfather's. You were pretty young at the time, if I remember, and I wonder how it felt to see this in your family and what was the impact.
So I think that was an interesting part of my journey with recognizing cancer. So when my grandfather was diagnosed, I was, like you said, I was very young. So you don't really know what cancer is. You don't really know what's going on, but you can just feel how people are interacting. You can tell that something's wrong, but you don't really understand it. And I think that really, really impacted me as I got to see it firsthand from how big of an effect cancer has on not just the patient with it, but the family. And I also got to see, as I got older, how big of a role that the provider played in the cancer journey of each patient. So I really respected my grandfather, as most grandkids do. And he liked his cancer care providers, his oncologists, the nurses, and everybody that were at Markey Cancer Center. And so as I was growing up, I kind of transitioned more into the understanding of how it affected everyone. And then I was like, okay, so this is what's going on. And then I got to see, even when I was still early on in college, when he was still receiving treatment here at Markey, got to see the power of the advanced medicine that goes on at big cancer care centers. Because I'm from about 2.5 hours from here, from Lexington. So to get cancer treatment, this is the closest place you can go to get that kind of care. So I remember my grandfather would drive up to Lexington, and there's a Hope Lodge here in Lexington. He got to stay there a few times, but I got to see how much of a toll that took on him. And so it was kind of a unique transition into understanding the emotions around it and how it affected everyone. And then I got to kind of see more of the science side when I was middle, high school, and then transitioning into college. I got to see how much of a role that can play if people are able to get that quality cancer care. So I think that was a great part of that journey, being able to see it through different stages as I got older. And thankfully to cancer care at places like Marquis. In the book, I think I even wrote that he lived 15 years after his initial diagnosis. So I do think that played a big role in how I decided to do what I'm doing now and kind of get involved with the action program, which was amazing for me. So yeah, I think that was really interesting. And I think that progression made a big difference.
In your essays, you both describe the high rate of cancer that Dr. Vanderford already talked about, and you identify some reasons. I wonder what your research showed. Michael, do you want to start?
Yeah, so I got the amazing opportunity with Dr. Vanderford's direction to work in a research lab. They moved here recently to another university, but I got to work in that research lab for 2 to 3 years and worked mainly on a project. So they knew I was coming from the action program, and the PI that I was working for knew Dr. Vanderford. So they let me work with one of the postdocs on an Appalachian lung cancer project, which was amazing. So my grandfather's tumor metastasized to his lung, so he lived with lung cancer for many years. So I got to work with that project, and some of this stuff has been published, but we were using mass spectrometry to investigate the tumor microenvironment of lung cancer patients from Appalachia versus non-Appalachia patients. So that's the cool thing about the Markey Cancer Center here, is they get these patient samples and they put whether these patients were from Appalachian counties, so those 54 counties that the action program has, and then patients that weren't from there with different types of lung tumors. And we compared these lung tumors and trying to investigate whether diet plays a role in that. So the Appalachian region is well known for poor dietary habits, and it's not because people have a choice. It's because a lot of places don't have fresh food around. The nearest Walmart could be 45 minutes, an hour away. So you've got to go to McDonald's. You have to go to Wendy's. You don't really have a choice if you're running late at night. You've worked a 12-hour shift. So a lot of these individuals have to pretty much eat unhealthy, and we wanted to investigate the impacts of these unhealthy diets on this and eventually transfer that into other studies and things. That's an ongoing process. It's a big project, but I was really glad to be able to do that. And one thing that I wanted to say was it was really interesting. So I got to go out of state to present some of the data that we had, and people that were from states that not around Kentucky, they had no idea that this was such a big issue, and they were really surprised. And that was another really interesting thing to me. And I was glad that I talked about some of the statistics in the book, because I don't think even in the Appalachian region, I don't think a lot of people realize the rates that we have and how much difference some of those like food insecurity and stuff is between there and places like Lexington, places like these bigger cities. And I also know that plays a role to areas in the bigger cities that are really far away from fresh food. So I think that investigating that Appalachian lung cancer area may unlock a lot of answers to what's going on in a lot of these regions that have these insecurities and a lot of the issues that we have in the region.
Yeah, lots of social determinants of health play a role. Susanna, in your essay, you also talk about opportunities to maybe turn the tide a little bit in Kentucky, make advances on these issues. I wonder if you could tell us your thoughts on that.
Yeah, like Michael was talking about, where there's so many factors that go into these high cancer rates in Eastern Kentucky. I think it's difficult to target all those factors at once, but I think just having the overarching goal to try to improve, help Eastern Kentucky have a healthier lifestyle, as Michael was kind of talking with the obesity rates. I think that might be a high correlation between that and cancer, to just try to encourage healthy eating habits, which is difficult because of, the distance you have to drive sometimes to go to a grocery store when you live in a very rural area, and the just availability of fast food over other types of food. But I think just trying to target some of these factors might be a good way to start the process of helping to decrease these cancer rates, along with also just preventative screenings. I'm into preventative screening since that's what caught my mom's cancer. But it's hard to get to the doctor sometimes when you live very far away to do a screen that might not even detect anything. You can see how it would be hard to motivate yourself or find the time or resources to be able to do that. We don't even know for sure it will help. But just making all of these things more accessible, I think, could be a good start.
Thanks. So I'm curious, what was it like to be in the action program, Susanna? And I think you indicated that you were already interested in medicine when your mom was diagnosed. So maybe those are longstanding interests. But I wonder if it's influenced perhaps even the direction of the medicine that you intend to practice.
It definitely has influenced the direction of medicine. I've intended to practice. When I first started undergrad, I was interested in medicine because of growing up with my sister with cerebral palsy, as I previously mentioned. So I was looking into PM&R, physical medicine and rehabilitation, and I was just kind of looking into specialties like that because I wanted to be a doctor like the doctors that have worked with my sister. And I definitely never even thought of oncology. I just thought what everyone else thinks, oh, that would be so sad. And then my mom got diagnosed, and I saw what impact her doctor had on my family and on her cancer journey, and how amazing her doctor was. When my dad did that first phone call, he said, "I wish you were here just so you could see her doctor. She's amazing. You need to be a doctor like her." And then through the action program, I got the opportunity to shadow my mom's doctor specifically and other oncologists a lot all throughout my undergrad experience. And something that I saw over and over again is that these doctors had such a high impact on their patients' lives. And when you have a cancer diagnosis, it is likely going to be one of the worst times of your life. And it just kind of resonated with me that I could be someone to help people through that time of their life and be there for them and help make this worst time in their life hopefully not as bad and help them get through it.
Yeah. I think that's fantastic. I wish you all the best in that journey. Michael, you already indicated a little bit that the action program influenced your choice to go to medical school later this year. Are you thinking of oncology as a specialty?
Yeah, the action program definitely influenced my decision to do that. So I already had that previous experience with cancer, but coming from a small town in the Appalachian region, you don't have anybody to ask what to do. So you kind of just you come here on campus with a bag and you got to figure it out from there. And I've noticed that some of the individuals that had these interactions with colleges while they were in high school and stuff, they kind of knew what was going on. They already found a research lab right after they graduated high school. So I was influenced to that, but I didn't know how to go about it. I knew I was here. I Googled everything that I could, but the action program was really pivotal in helping me direct my career trajectory to what I wanted to do and what I was really interested in. So working with Dr. Vanderford and Chris, my first semester, I was just trying to make it through college. So that the action program was like a backbone of support of like, what should I do here? What do I need to do? And they helped me find shadowing opportunities while we were still able to shadow my freshman and sophomore year. And I got to shadow oncology. I got to shadow a great oncologist. And he actually worked with my grandfather, like Susanna said, her oncologist that she shadowed, worked with her mother. So I got to shadow an oncologist and see how much of a role he played with his patients. And it was amazing to see that interaction. So I got to go to with my grandfather to a few of his oncologist appointments. And so getting to see that, because whenever you're going with a family member, it's a little bit different because it's hard to listen whenever you're hearing the word cancer and it's somebody so close to you. But if you get to sit on the outside and watch a provider interact with the patient and their family, it's just really amazing to watch whenever you have a really good physician. So the action program brought that opportunity. And then further, the opportunity to work in a research lab and see what goes on behind all of that. So and see what's really driving the needle as far as cancer research and cancer therapeutics and care goes. So I got to do all of these things and immerse myself in these opportunities. I wouldn't have even known how to type up an email. I didn't know you could type up an email and ask a PI if you could work in their lab. And it was thanks to Dr. Vanderford helping me navigate all of that, because you kind of get in, you get slammed with all these opportunities, and you just got to throw your hands up and grab as many as you can, like you're in a money tunnel, and you just got to grab the $1 bills. So the action program helped me navigate that and really decide, like, hey, I'm very interested in oncology. I know that I still have a lot to learn and things can change, but I will always have that. I know for sure that I will always have that piece of cancer care, cancer education, cancer outreach, even if I decide to do primary care in a rural area or oncology. I will still know that how important cancer education is, and especially to the Appalachian region of Kentucky. So the action program was very pivotal in me navigating those pathways and figuring out what opportunities I should take advantage of.
Thank you for sharing that. I likewise wish you all the best in your journey. Michael, to end with, I wonder, what would you say to someone perhaps coming up behind you, someone younger, if they were thinking about cancer as a career, what would you say to them?
First things first, with everybody that even mentions that to me, if they're from the county I'm from or any of the other 53 counties involved with action, I say apply to action. We've got a little program here at school, and I tell everybody in there, I'm like, you need to apply to the action program. It's amazing. We had Dr. Vanderford come talk. So, and based off that, I know that there are some students that can, or whatever happens. And what I would say is find a mentor. And I think that's important. And I think that's a great thing that the action program provides. It's because you can't navigate all that stuff alone. So especially being a young student, a freshman here, because UK's a great research institution here in the state of Kentucky, and coming from a high school, it doesn't really matter the size. You're going to be in a bigger place than you've ever been before, and the classes are going to be bigger than any class you've been in. And as a young student coming in at 18 years old, you can't navigate that alone. So I would say one of the main things is find a mentor, find mentors to help guide you on the path that you want to go. And that's the amazing thing that I've seen with Action Program and a lot of other faculty here is they're really willing to help undergraduate students, which has also been very great for me because I hope one day that I'm able to provide some type of help to somebody. I don't know if anybody would want my advice, but I can at least tell them what not to do sometimes, maybe.
I'm sure they would.
But I think mentorship and just immersing yourself in the opportunities available are probably the two biggest pieces of advice that I would give.
Susanna, what about you?
I would tell that student to not be afraid to get involved in research, get involved in shadowing, because when I first started undergrad, that was my main issue is that I was just too scared to reach out to anyone, too scared to I research the thought of that just intimidated so much. And I really needed action. I was so grateful for it because I needed someone to basically hold my hand while I wrote an email to the PIs and like tell me that it was okay, look over it, and tell me that I deserve to be there and I deserve to do research too, because I felt a lot of times that I came from a high school that was really, really small. We didn't have a super strong science program just because of the size of it. And then in my classes, I was surrounded by a bunch of people that went to these fancy high schools and they did AP this and that I just didn't have. So I needed some guidance and someone tell me that I can do the research and do the shadowing and all the things that are important to do if you want to go to medical school and confirm your interest in medical school and then oncology.
Thank you. Dr. Vanderford, the last word to you. I'm sure you have that conversation with a lot of students as well. What advice do you give them?
Well, I think, as I said earlier, these are just such phenomenal opportunities, to be here at this university, others like it, where you have an opportunity to do research, shadowing. We're fortunate that we are on a campus where, the undergraduate campus is on it's at the same location as the medical school. So I tell students all the time, you can go from your chemistry classroom, walk 5 minutes down Rose Street, and you can be in a world-class research lab, or you can be in an OR observing a cancer surgery, and take advantage of those opportunities. I think as the students have said, these are phenomenal opportunities that are going to be transformational for you as an undergraduate student, but also for your future in whatever it is you want to do. So take advantage, you got to manage your time well and do well in classes, but all these other activities, they're at your fingertips, and it's great things to take part of.
Well, thank you all very much. I very much appreciate you sharing your journeys and your insights. Thank you.
Thank you for having us.
Yeah, I appreciate you having us.
Now it's time for a segment we call Your Turn, because it's a chance for our listeners to send in a recommendation that they would like to share. If you're listening, then you're invited to take your turn. Send us a tip of a book or a video, a podcast or a talk that you found inspirational or amusing or interesting. You can send those to us at nciicc@nih.gov. Record a voice memo and send it along. We may just play it in an upcoming episode. Now I'd like to invite our guests to take their turn. Let's start with you, Dr. Vanderford.
Yeah, I've given this a lot of thought, and I think I want to recommend the books we've already talked about. The books are titled The Cancer Crisis in Appalachia, Kentucky Students Take Action. And I think if you want to, if listeners want a better understanding of the cancer problem in Kentucky, and particularly the problem through the lens of our students and what they think the problems are and how to deal with those problems, then these books are phenomenal. A phenomenal lens to sort of get perspective on that.
Thank you. Susanna, it's your turn.
So this is not necessarily cancer related, but just a random book recommendation. It's one I just got back into, kind of not really reading, but listening to audio books and such as I like drive or walk, which is a great way to relieve some stress and just take my mind off medical school. Sometimes you need to do that. But the most recent one that I listened to is The Guest List by Lucy Foley. I think that's how you pronounce her last name. And that book, let me tell you, it starts out kind of like here on suspense and it just gradually builds. So if you need a way to de-stress by getting stressed about something else, I think that's a great book to listen or read.
Thank you, Susanna. Michael, please take a turn.
I wanted to mention this. I thought that maybe Dr. Vanderford might steal it, but the Action Program has the Cancer in Appalachia page where they post these pictures of that students take from around the state of Kentucky and did just represent cancer in the area. And I've always thought that was really interesting because a lot of them are high school students too, and just see like behind the mind before you kind of get immersed in like being stressed out about medical school or being stressed out about science classes, what you think about the cancer, what reminds you of cancer. And I think that the images and things that the students upload are really cool and better pictures than I would ever take. So I just like to scroll on there and see what could be if I had a steady hand and could take a good photo. So I think that's really interesting.
Thank you for sharing that. I was going to recommend the books that Dr. Vanderford already recommended, the books from this program. So I will just endorse his recommendation and remind our listeners that links to all of these recommendations can be found on our show notes and on our webpage. And with that, I'll thank our guests one more time and thank you.
So much for having us.
Thank you for having us.
That's all we have time for on today's episode of Inside Cancer Careers. Thank you for joining us, and thank you to our guests. We want to hear from you. Your stories, your ideas, and your feedback are always welcome. And you're invited to take your turn to make a recommendation that we can share with our listeners. You can reach us at ncicc@nih.gov. Inside Cancer Careers is a collaboration between NCI's Office of Communications and Public Liaison and the Center for Cancer Training. It is produced by Angela Jones and Astrid Masfar and edited by Jeanette Gozer. A special thanks to Lakshmi Grama and Sabrina Islam Rahman. Join us every first and third Thursday of the month when new episodes can be found wherever you listen. Subscribe so you won't miss an episode. I'm your host, Oliver Bogler from the National Cancer Institute, and I look forward to sharing your stories here on Inside Cancer Careers. If you have questions about cancer or comments about this podcast, email us at nciinfo@nih.gov or call us at 800-422-6237. And please be sure to mention Inside Cancer Careers in your query. We are a production of the U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute. Thanks for listening.